So your background and training, you came from Poland. You're a board-certified neonatologist, taking care of babies. Is that right?
Yes.
Pediatrician.
Yes.
How'd you get involved in skincare? I mean, tell me a little bit about it. I mean, came from Poland.
I came from Poland. I finished my medical school there. I was involved in Solidarity during medical school. I learned that there was not too many opportunities for me because of the political background.
You can't choose your medicine there? I mean, you couldn't decide?
No, actually, that's you're going to... my mom, both my parents were doctors.
Okay.
And I learned that it would be better for us to leave. We arranged safe escape with my husband and 2 kids, came to America in 1987, worked hard, finished my residency in pediatrics, followed by neonatology fellowship, became a neonatologist, joined Children's Hospital of Orange County.
You're involved in a few hospitals, is that right?
I am. I was hired 16 years ago by Children's Hospital of Orange County, which, by the way, they interview 2 days of interviews, every hour with another doctor for 2 days. Got this job. Obviously was doing well there, so they make me director of one of the neonatal intensive care unit in Westmed Santa Ana.
So this intensive care, so this is only for really sick babies? Or babies that are premature babies? Or all the above?
Any baby who is not perfect is my patient. And we're talking about premature babies, and we're talking about babies who may weigh less than 1 pound. And amazing feeling. You are there in the hospital. When you are there in the hospital, you're the only one who can intubate and resuscitate baby like that and give a baby 80 years of life. So this is fascinating, and I will never want to let go because this is what I was born to do. However, somewhere there, I learned about lasers and fascinating results with the results which can be obtained with the lasers. So what's this intensive care personality is fulfilled when I can see instant result. I can give the medication, heart rate goes up. I can give another one, heart rate go down. I can use this laser and get rid of the wrinkle. I can use this filler and change a person's life. So
you're saving babies' lives. That's
during daytime.
80% of your life. 80%. And then the other part is making people look younger.
Because it's easy. I figure that if I can save a failing kidney and heart of 1 pound baby, surely I can help the skin. And my intensive care personality allows me to use the devices to the maximum so I can get the maximum result.
So when you say intensive care personality, meaning like a sense of urgency or aggressiveness with making people better?
Absolutely. You know, I love medicine, and I love every aspect of medicine. I will tell you about a few patients who changed my life, who I'm super proud of. There was this one patient who came to me. She lost 2 of her brothers when they were 60. They were committing suicide. Here she was, close to 60 and desperate, and was having some medical issue, her shoulder surgery, so needed shoulder surgery, and was just afraid that she was going to do the same thing. Well, we used our combination of lasers. We used a little bit of Botox. She's still my patient.
So a little bit of Botox,
little bit of Botox, little bit of lasers, and this person is as happy as could be. And we are now, what, 67 years old? That was like 7 years ago. Now, I had a patient of whom I'm very proud. She was the oldest patient I've ever took care of. She was 90, and she was getting ready for her birthday. Why is it important? Because the same week, I was taking care of the smallest baby ever. This was a 450-gram baby. So imagine this wonderful life I have when I can work with somebody who is so fragile and so tiny, and then go to my clinic and help somebody who is now 90 years old. Medicine is absolutely the most rewarding profession you could imagine. Both parents were doctors. 2 of my 3 kids are doctors already, and the 3rd one wants to be a doctor. So I love medicine, and I love what you can do.
You're saving babies' lives. Do you ever feel like maybe you're saving some adults' lives as well by giving them their self-esteem back?
And how many stories I can tell you. One of the latest ones didn't happen that long ago. I have this patient on whom we did a lip injection, and she went to the bar right after the lip injection. She found a friend. She is getting married, you know. Really, it wasn't the lip injection. It was her self-confidence, which was just so improved that all of a sudden she found the person for the life.
So it's equal.
It's equal.
I mean, both saving babies and making people look younger, giving them their self-esteem back.
I wouldn't want to not do any of those, you know. I think that this is me being able to practice aesthetic medicine is like a bonus for me being good in intensive care unit. Now I've got this other life and other career. And as I said, I have 2 countries to love, 2 cultures to cherish, and I have just different part of medicine which I can enjoy.
Now, so it's not so much about being pretty, but it's about looking the best you can?
It's really about look, it's really about how you feel inside, you know, and I can make anybody feel better using the combination of different procedures. And that is something what is making the whole difference in the person's outlook on life.
By doing that. And you've done it to yourself?
Yes.
You feel that much better? Because you have exceptional skin.
Well, but I didn't, you know. That's thanks to all the lasers. Well, we can be honest. I was telling you the story about me being an ugly duckling and turning to a duck, missing this one thing, but all of a sudden, here I am, and my skin looks good, and I know how fantastic that feels, and how rewarding that is, and how much self-confidence that gives you.